The next part of our program is called Leadership for Customer-Centric Business Transformation. We're very fortunate we have two very skilled people in this field who will be addressing this for us. And what I'm going to do is I'm going to first introduce Steve Krumenaker, give a little information on him. Steve will do his presentation, and then Suzanne Ron from Health will be next, and we'll continue from there. And guys, you want questions during or after your sessions?
I'll take them both anyway.
Oh, so fire away when you're ready. So what I'm going to do, without further ado, is introduce Steve Krumenaker to you. Steve has over 20 years of experience in our industry, specifically in the customer experience area. He's been with Salesforce for the past 2 years, and he's a strategic account rep for the healthcare industry. Now, he's not a healthcare professional, but he knows a heck of a lot about the healthcare industry. He's primarily working with partners, with payers for healthcare insurance, and he's focused on delivering a 360-degree view to his clients. Previously, he was with Avaya for several years, handling multi-channel communications, and prior to Avaya, Steve was the CTO for iSky. And in case you didn't know, Steve is also a member of our chapter board here. And so without further ado, I'd like to have Mr. Steve Krumenaker come up here.
Thanks. Is this on? Can you hear me? Raise your hand if you can hear me. Raise your hand if you want to hear me.
Let's facilitate.
So as Frank said, I'm relatively new to the healthcare industry. I've been in customer service working for Avaya for actually 11 years, 12 years before that. And so I've been in and around contact centers for many, many years. Joined Salesforce and ended up in the healthcare industry, mostly because I lived in New Jersey and they needed somebody to cover life sciences. So I found myself a healthcare expert. And then I quickly shifted over to the payer and provider market. And what I found out is that in many ways, healthcare is no different than any other industry dealing with customers. And in some ways, it was completely different. It is one of the most dysfunctional industries I've ever seen. And Suzanne is also new. She'll probably say something similar to that. So I wanted to just talk about how we at Salesforce kind of approach it, what our point of view is as to how to help this process. If you think about it, everybody in this room has had some dealing with the healthcare industry. Hopefully less is better in this case. And if you think back to your experiences from going one doctor to the next doctor, think about something very simple, right? Everybody's going electronic for medical records. And how do the doctors communicate when you visit one and get it back to your primary care? They send a fax. That's how they do it. Very, very few doctors do anything other than that. Some use email today. So that kind of sets the stage. There's an incredible amount of high technology in healthcare, and they don't communicate at all. So let's talk about that. So I'm going to start out really talking a little bit about the ACA, not to take a political positioning, but what I've learned as I've been in this industry for a couple of years is that the common knowledge of what the ACA is, it has really nothing to do with what it really is. So we'll talk about that a little bit. Talk a little bit about the patient journey, what we do at Salesforce, and then this is really a slide that we put in for both of us. So then Suzanne's going to talk about what she's doing in health. So let's ask a couple of questions. If you look at the list on the left, remember when the ACA or Obamacare first came out, it was about the death panels, remember those? The end of healthcare. These are things that you read in the paper and we all heard about. It was the fear factor. Well, what it really is about delivering universal access to healthcare. It's about trying to bring the technologies that are going on in healthcare together. And it's not easy. It's really a long-term program to change the way we deliver healthcare in this country. What it's really about is making healthcare a national priority. Right? The basic idea is to change healthcare from a delivery, which it is today in terms of how do people get paid in healthcare. They get paid for their activity. You go to 3 different doctors, get 3 different sets of blood tests, they can do the same test. Everybody gets paid, unless your insurance company kind of doesn't like that. But what it's not really about, if you think about it, is the health outcomes. Okay, so what we're trying to shift is, how do you change from paying for activity to paying for outcomes? And it's really all about how do you shift the mindset of the people in the country and the professionals in healthcare to one of which, let's take a look at the population health is called, and how do we figure out how to improve the health of that whole population? It's about preventive care. It's about doing the things to prevent costly visits to emergency rooms. So it's really a much bigger picture than what the press would have it believe. Whether you think Obamacare is a good law or a bad law, I really don't know whether it is or not, but I know that the basic function or the basic goal of what it's trying to accomplish is a good thing. Let's look a little more, right? Reimbursement rates, you probably don't know this. Reimbursement rates, at least for Medicare, are based on customer sat. You wouldn't think healthcare measures customer sat, but it does. There's an HCAHPS score, which is, I won't even tell you what that is, but it measures customer satisfaction scores of the people that visit healthcare providers. And literally, their reimbursement rates depend on their scores. How many stars they get. It's called star rating. Preventive care, covered for the most part at no cost. So you probably know that you can get an annual physical for free. There's a number of other things you can get for this. These are all part of Obamacare. Extends coverage to young adults. And most pre-existing conditions no longer get stopped. In other words, you can get pre-existing condition, you can cross healthcare payers or insurance companies without worrying about it. And there is formal appeal processes if you don't agree with what your insurance company said. So anyway, the point of this is it's really a broad-based law that's trying to improve health outcomes. That's the goal. Whether, again, it's a good law or not, hard to say. I'm not going to take a position on that. But what's really interesting is that the people that are now in the market are very different than the people that were. And this is the key piece of why everybody in healthcare is trying to do something. There's 25 million Americans that are suddenly under, or could be under healthcare. But these folks are not the same folks, or not typical of the same folks that were covered before that. Right? These folks are the ones that have a lot of pre-existing conditions. Why is that? Because they couldn't, they were people that couldn't afford to get medical care, couldn't afford to get coverage. They would go to emergency rooms. So these folks are the people that like to go to emergency rooms. They're 6 times more likely to call up call center instead of using self-service if it's available. So the point is, these are expensive people to cover. And now it's a competitive market, right? In the individual market, you can actually choose your healthcare provider or insurance company. So insurance companies are moving from essentially getting business from groups who are employers to perhaps go into individual markets. And this is just a shift that's just beginning, but eventually most of our insurance coverage for healthcare will be individualized markets. So whether that's paid for by your employer or not, it's going to be an individual choice. So you have these things called public exchanges, private exchanges, a whole lot of stuff going on here. But really the point is that suddenly this is a business that is competitive. And healthcare providers and payers of the insurance companies, are now faced with how do I keep my business and I don't lose the individuals that are coming to me? How do I get them? So I have to market. It's suddenly changing from a B2B business, selling businesses to businesses, to a B2C. And that changes everything. One of the most interesting studies is the consumer's trust, right? Healthcare plans, payers, insurance companies want you to trust them because they actually want you to help you, guide you as to how to improve your healthcare, because it's good for them. So by a show of hands, how many people here trust their insurance company? And that's fairly typical. Okay. Never use it, that's even better, right? But the point is that healthcare providers, none of us trust any of our insurance companies, right? Because their job is not to pay us. That's how they make money, that's the thing. But if you look at it over the long term, their job is to keep you healthy because it costs them less. How do they do that? They need to get a better relationship with you. They need to engage you. They need to get you involved. They need to do a good service for you so you continue to go back to them. And it's okay if you have issues. They know people have issues, healthcare, but they want you as a customer, so they've got to change the way they do business. Because not only we don't trust our insurance providers, how many people here think it's easy to do business with their insurance provider? Healthcare. Okay, we got a few. Are you guys from Emblem? What? So, healthcare company or providers, payers and providers both know this. And the hospitals are in the same position, right? Because they realize that people have a choice. Which hospital do I go to when I need service? Sometimes it's an emergency. Sometimes, very often it's not. And they have to provide good service. You see billboards all over the place now with only 3-minute wait time for the ER. They're trying to market to you is what they're trying to do, right? So the problem for both payers and providers, though, is that the experience you get from the beginning of your interactions to the end, there's a whole lot of places you can interact with them, is all disjointed. They have many, many systems. They have a claim system, the billing systems, the memberships. They have self-service on occasion. Some of them even have mobile apps, right? But all of these are separate. So it's very hard for them to bring the experience together and make it look smooth from piece to piece of it. So you can interact with your healthcare providers at the doctor's office, at the emergency rooms, in many, many different places. The problem we think that exists is really, it's one of silos. If you think about what kinds of systems are in healthcare payers and providers, this is just a small list of them, but these are all independent systems, IT systems that are built around the function that they have to provide. The patient referrals, the inventory, the bed inventory, the supply inventory, the call centers, the members, who you call, you get somebody you want, I got a problem with my claim, am I covered? These are questions that they all have to answer, right? So essentially what happens here is there's a lot of line of business, a lot of different systems, and these are all systems of record that are probably pretty good at what they do, but what they don't do is really look at it from the patient or the member point of view, and this is what we think is the real problem. So both payers and providers are shifting to a new view of the world called the patient-centric view. There's a lot of different words for this patient life cycle, but really they're trying to look at this from a patient. So if I want to understand what Steve Krumenaker, how my healthcare dealings with their particular health system, I'd really like to look at one place and get all this other stuff to flow into it instead of having to look at 15 different places. So my daughter is a social worker in a hospital system in New Jersey, and I was talking to her the other day. I said, when you have to discharge, her job is to discharge people and bring them to set it up in another facility. I said, when you do this, how many systems do you have to look at? And she rattled off about 12 systems. I look at this, I look at this, I look at this, and oh, by the way, I got also, and then she kept going on and on and on. And that's the issue, right? Because none of those are patient-centric. None of those, you have to know 12 or 15 or 20 different systems in order to actually have a good relationship or deliver the right answer. So this is a tough thing that companies are trying to do, and everybody is trying to do it. So it's not like an unknown problem. This isn't a new discovery. They know this, but they are having trouble solving it. And what our point of view is at Salesforce, and this is kind of our business, so it's really why we're talking here, is it's all about the engagement layer, right? We have to figure out or help the healthcare providers and payers build engagement with their customers. And engagement means a lot of different things. But it has to be different than what it is today. And that's really the big way to think, right? So that's why folks like Suzanne from the publishing industry, folks like me from the communication, we're all brought together into this industry because they realize, healthcare folks realize that they don't know how to solve this. So we're trying to solve it from people that are outside the industry and bring in things from retail, bring in things from other industries so we can actually address this, because Amazon figured this out a long time ago, right? I mean, they're still working on it, but this stuff is not unknown things. It's just not done well in healthcare. So it's about personalizing the interactions, getting real-time responses and collaboration. There's a lot of stories around folks going to the hospital, right, and they get, for a particular condition, and they bring in different specialties. And the specialties don't really get coordinated. And if you've had a loved one in the hospital, call from the doctor to doctor, they half the time don't know what the other one is doing. And if you look into it, one of the reasons they don't know what the other one is doing, you'll find out is that each one of them has a different EMR, or electronic medical record system, that doesn't talk to each other, and they don't have visibility into it in many cases. Sometimes they do, but it's typical that they don't. And this is it's a technology problem, because the EMRs don't talk to each other. So what we're trying to do is we're saying, let's take a look at how we view this patient experience in a different way. So we said, let's take a look at the life cycle of a patient. And this is a life cycle that could be in a retail customer, could be from anything, right? But there's a period of time when a patient or a member evaluates their different suppliers, whether it's a hospital or whether it's an insurance company or whatever. You can do this in any industry. You kind of get aware of something, you actively evaluate it, and then you decide, yeah, that's what I'm going to do. I'm going to go on board with this company, with this supplier. And there's a process that you get to, hey, I got a health guy, I got an insurance card, right? And now I'm going to get into the hospital. I've already done some of the onboarding, the blood work before I get in. There's a process. And now I'm a regular user, or maybe it's a short-term, long-term care thing, but I'm using the facility. So how do I interact? I have an issue with this. I call somebody. Can I look on the web? but it's a real process. And eventually, I finish it. Maybe I finish my contract, my year's up. I can expand it. I want to do a little bit of cross-sell. Like companies want to sell me more, maybe I want more services, right? And then eventually I go back into the cycle and reevaluate. Okay, it's a new open enrollment period. What new benefits do I want? So they're selling me during the year, and they're making decisions, but eventually I have to make another decision. And it's a big circle. So that's a way to look at this that healthcare companies typically don't do. So if you actually look at some of the detail behind this on the provider side as well as the member side, there's a whole lot of things you can do that may be looked at as projects, and a lot of them are doing these individual things in any stage of this life cycle. But it's a new way to approach it. And the goal is to say, look, let's take a look at the patient experience on the right or on the left, doesn't matter. There's all kinds of different things that folks do, whether it's interviewing patients, we get feedback, we have physician referrals, we have credentialing, we have quote-to-card activities. All of this stuff is going on independently. And I think what needs to be done is you need to start to bring this stuff together. And the idea would be to say, let's connect it all in the middle, and the connecting point is the customer, the member, the patient. I'm in the middle, and I have access to all these other systems, but they shouldn't be the primary way I get the information. Right? So what you need is something to bring all this stuff together and know the fact that I went to that doctor last week, went to this doctor this week, and next week I have 3 blood tests. And when I go to the doctor, they have the results of all of that stuff. Right? So what we're talking about here is trying to connect that circle, connect the dots. There's some kind of a system that talks to all those others. It's not going to replace any of those because they all do what they do. And they do it pretty well in general, but the problem is they're all islands or they're all silos. So if you can connect it up in the middle and somehow look at it as a patient experience and you have access to all this information, it changes the way we can deliver that interaction because now I know what else is going on and I can make a more intelligent, or I can have a more intelligent discussion because I actually see all the blood tests that I did, or I see all the ailments that I've had, and I can begin to say, let me put all the symptoms together and figure out what's really going on instead of going to each doctor independently who looks at only the stuff that he's really aware of. So the positioning that we take, and we think that anybody should take it, doesn't matter whether it's us or not, is that what you need is another system of record, and what that system of record is about the engagement. So you have all these systems of record that for clinical and diagnostics and all this other stuff. What you need is an interaction layer that talks to all of that stuff and can give that stuff to the agent if needed or on a self-service portal. But what you're really getting out of that engagement layer is a history of all the interactions that I've had with regardless of who I have. The details are all on the bottom of it, right? But it's the interaction with all that stuff which lets me look at the picture as a whole and figure out what's really going on. And that's kind of the point of this layer. It becomes another system of record for the interactions themselves and what happens in the interactions. It's also called, we call it an engagement platform, engagement layer, it doesn't matter what you call it, but the interactions, how we engage with the people, that's how you improve engagement because you have to have a way to measure engagement, track engagement, or you can't improve it. So that's kind of what we're talking to a lot of healthcare providers and payers to try to deliver. This is the stuff we've done for other industries for many years, right? So this is the stuff we're talking to healthcare providers on. So think about if you go to, wouldn't it be cool if you're a healthcare provider or as a consumer, we got kind of a continuum of care where everybody knew who I was, why I'm calling, what the context of the phone call or the visit is. And this is no different than Amazon does. When you log on Amazon, you get recommendations because they know what you've done in the past. Same thing with healthcare. So why can't we tie all this stuff together and deliver kind of an anywhere, anytime, seamless experience? So I'll give a little bit of story. City of Hope, which is a healthcare system in the West, did exactly this a few years ago. And this is, on one layer of theory, on one hand, this is all theory, but on the other hand, this gets right into what goes on in the contact center, what we're all trying to do in a contact center, which is call the flush to get more efficiency, as well as get increased customer sat. They reduced the average call time by 42%. Now, why did that happen? It happened primarily because the agents, when they answered the phones, were able to get at the information they needed to answer the question that the caller asked about. Instead of having to go to all these different systems and figure out where it was and maybe have to call them back or not get it, they had it all in front of them. So it's very simple. Hey, I gave a 360-degree view of the patient, single pane of glass, and all I'm delivering, I'm connecting up with all those other systems, we're not replacing any of those, but now the agent actually can do a good job. So that's what that's all about. So when it comes down to it, in a contact center world, what are we delivering? We're delivering single pane of glass, 360-degree view. Every one of you has talked about that. Every one of you wants to do it, not limited to the healthcare. But that's what these folks did. And their statistic is, hey, they handled 1 million more calls. I'm not sure what time it was, but without any increased FTEs. So that's pretty cool. It doesn't only end in the call center, though. It really has to go to any platform because we're all mobile today. So what you really need when I talk about a platform or engagement layer, you need to interact, you need to think about this being on your mobile devices, or iPads, iPhones, whatever. But it also has to now go into the Internet of Things, which is a whole different topic. How many here, anybody here have an Apple Watch? How about a Fitbit? Or something like a Fitbit? So where does your Fitbit information go? It goes into your phone, right? Probably? Anybody have a Fitbit information going to your healthcare provider, your doctor? Wouldn't that be kind of cool though, if it did? Because now your healthcare, or your provider, your doctor, instead of doing an EKG, saying, or ECG, say, hey, your statistics at the moment are this. Let me look over time, and instead of asking you how much you're exercising, I can actually know the answer, which is a good thing and a bad thing. But the real point is I can look at trends, right? But it goes more than that. The diabetes, insulin pumps. I mean, think about the feedback loops. If you start connecting all this stuff together, you can actually start to deliver better healthcare. So it's important to have a central location that you can get at all of this information. Another story, we'll find out if you ever talk to people at Salesforce, we're big on customer stories, but Johns Hopkins manages a population around Baltimore, and what they found was there was a lot of things they couldn't figure out why this group of people had so much more visits to emergency rooms, cost so much more than this group of people. What they were able to figure out was this really socioeconomic kind of things. People didn't have access to doctors, so they went to the emergency rooms. People didn't have access to pharmacies that deliver. So what they do, they didn't take their meds. What did that mean? They either go to the emergency room and they go back in the hospital. That costs everybody more money. So Johns Hopkins has been one of the leaders really in trying to get at figuring out what actually makes a difference in fixing some of those problems. So they're, and of course they're using Salesforce as well for that. So what I wanted to close with is a short 2-minute video, which is more of a vision that we talk to customers a lot about, but it kind of describes it. Wouldn't it be cool if your healthcare interactions kind of looked like this? So it goes all the way from the acquisition and marketing phase to healthcare delivery. So let me make this one.
The Salesforce Member Connect solution for healthcare lets you easily engage and turn prospects into members faster. Potential customers can now quickly shop for a health plan in their preferred language, supplying just a few pieces of information to get started. Even chat live with a support agent. Then view the plans that best fit their needs, as well as competitive plans from other providers. The application has already started for them by pulling in data from their social media account. They can choose their contact preferences, including Facebook, and sign instantly to begin their membership, immediately providing feedback about their experience while sharing with their social networks. Members can then access the community to find a doctor, download plan documents and claim forms, see past interactions, or find answers 24/7. Their homepage is personalized using profile information stored in Salesforce and connected devices like Fitbit or a glucose monitor. And when profile info is updated, it automatically appears on their digital ID card within the mobile app. Here they can access their plan, fill out claims, make payments, receive alerts for things like health goals, and discover articles and information relevant to that. Members can use the Health Concierge to chat with a trusted advisor, utilizing Siri for voice to text, or call to speak to the person they were just chatting with. In turn, the advisor is able to get a 360-degree view of the member in the Service Cloud console, set case reminders, and send notifications to members, allowing them to quickly find procedure options in their price range. Members can also stay up to date on billing, able to pay using FSA, immediately rating their experience, and receive payment confirmations sent right to their mobile device. Discover new ways to connect with Salesforce.
So should we take questions or?
I have a question. Margarita from Telecommunications Department. I guess the million-dollar question with creating a platform that relates to healthcare information is security. How do you secure such an environment? Because I think that would be one of the primary concerns today, not just in healthcare, I mean, in every.
It's a great question. There's a number of levels of that question, right? The first one is, oh gee, you're a cloud provider. You didn't actually say that, but that's scary. Are we HIPAA compliant? So first, we're HIPAA compliant. We undergo security screens from financial institutions, healthcare institutions, security audits, government agencies, and we pass every one of them. It's hard to think it through, but basically our business is based on how well our customers trust us, because we have customer data from 150,000 customers. I would challenge the security that we have versus any other company in the world, frankly, because our business is about security. And time after time when we undergo audits at Salesforce, I mean, we always pass them because we've got more layers of security than anyone can imagine. It turns out that most security breaches are not a part of the data. It's really somebody of the PC that got stolen, somebody downloaded it. And there's no way to prevent that from happening. Well, the data in the cloud is highly secure. And our customers trust us. That's our business. I think if we got breached, we'd be out of business, and that indicates how much effort that we put into it to make sure that doesn't happen.
So I think, as a member of a health insurance, like, now speaking from, Elena's position of just having health insurance, I think that would be a primary concern for people, and that would be something that would keep someone from wanting to get a mobile app that gives people access to. It's something that keeps people from mobile banking on their phones, and I think,
That's actually a great point. I mean, personally, I won't use a mobile app I'm a financial app on my phone. I will use it on iPads at home. I use it in a lot of places, but I'm concerned about the phone itself. That's a different kind of security issue than what you're asking me originally, because that app may not have anything to do with cloud software, right? Different layer of, different level of security, and it's an issue, right? But from a cloud security point of view, our stuff is encrypted in transit. Much of it is encrypted at rest where needed, and our security is many layers deeper than most companies, just because we spend an awful lot of money worrying about that stuff.
How well does, so there's a number of companies that are sort of in this space, right? Athena Health being one that's very close to mine, that's just provide that information infrastructure backbone in the industry to allow a bunch of these players to connect and sort of share information. How does Salesforce compare with the likes of Athena Health and Google and so forth?
Yeah, so if you look at, there's always niche, I'll call that a niche player, but if you kind of look across the customer engagement kind of platform, Gartner puts us in the upper right quadrant, far above to the right and far above everybody else in there. So from an analyst point of view, we're way out ahead of everybody else doing this. The best way to look is look on our website, look at what the customers are saying. Don't take my word for it. Listen to our customers. We have an annual conference called Dreamforce in San Francisco, where 150,000 customers come out. They're paid to get there, and 90% of the presentations over a 4-day period are the customers talking about what they've done with Salesforce. So, we started out as a Salesforce automation company, and we now basically have a platform where you can write applications to do process automation, customer engagement, and we have several of those products. So Gartner loves us. They put us up in the upper right. That's probably the best single point of proof I can give you.
One last question.